I think we're live. Krishan, thank you so much for being here.
Morning, Chet. How are you?
Yeah, I'm very good, very good. A little over caffeinated, I must admit, but yeah, I
Already
think
at this stage in the day?
yeah, exactly. Um, could you tell the audience about Tympa Health and yeah, and talk about the problem that you're solving?
Yeah, so thanks very much for having me on, certainly. So Tympa Health, what we are trying to do is to democratize hearing health to make it accessible to patients, not only in our own environment in the UK, but actually globally as well. And we feel that we've been able to do that with our technology and our hardware device, and we'll probably come on to uh, talk about that, but it's basically allows us to take the whole ear clinic out into the community and be able to link back into specialists. And
Mm.
technology has been at the heart of that. And yeah, we've been getting some good feedback on the kit so far.
Yeah, it's good to hear. And what was the problem that you when did you realize this was a real problem, and could you kind of highlight the certain steps and the kind of phases you realized, yeah, kind of talk about the problem that you're solving, and how you come to realize it was a problem.
So by background, I'm an ENT surgeon. So I think the problem came to me very early in my medical career. But the
Mm,
way the medicine works is you have to go through a number of hoops and get to a certain level. And so I did that, and I ended up working as a registrar in North West London. And when I was there, I had been seeing the problem throughout my career path so far, but it really hit back that I was seeing two issues really: hearing loss and how difficult it was for patients to access care. But then one of the interesting things I saw was that there were a lot of patients who were coming in. So when you go in to see your ear specialist, or if you went to your GP to have a problem with your ear, the first thing they do is look in the ear. And if there was something like wax in the way, then actually you wouldn't be able to progress the um, treatment plan or even make a diagnosis or go on to have a formal hearing test. So that problem became more apparent that I was seeing all these patients coming into specialist centres
mm,
to try to address their hearing. They'd come to address their hearing and then they'd have wax. We would then have to remove it,
mm,
then send them back to their GP to then go and end up having a formal hearing test. And the pathway was so disjointed and disconnected that I thought, well, I wanted to create, rather than have three pieces of equipment to do looking in the ear, removing wax, and then doing a hearing test, try and bring that all into one device. And
mm,
it really became apparent, I think, as a frontline clinician, that's where you see the problem at hand.
mm.
And what I wanted to do was do that, but bring technology into the mix as well with that. And that's where we developed this kit now, which is here.
Yeah. Yeah, I mean, it sounds like a basic question, but I mean, couldn't the ENT surgeon or the person looking into the ears just clear out the wax and then carry on? Or I mean, or
You can, and I think it probably, if you look at the pathway, so if you had someone who, let's say, had a problem with their ears or their hearing, end up going to see their GP, the GP tends to send them straight on to the audiologist.
hmm,
It's when the audiologist looks in the ear and there's wax, let's say, they then they can't remove it because they haven't either got the training or the tools to do that. Some of them do. They then can't remove it. So the almost appointment ends there. They have to then go back to the GP for the GP to remove, to send you to ENT, ENT remove,
hmm,
and we can't refer to audiology and then back to the GP. So it's really disjointed and disconnected. And when they come to ENT, yeah, we can remove the wax. But if they've come for a hearing problem, we don't do the hearing test. They then have to go to audiology,
hmm,
which is then a referral back to the GP.
yeah.
So it's really multiple paths, which has been the challenge.
1 second, Krisha, I'm just gonna knock you off the stream because I think your line is kind of fuzzing up.
Okay.
The sound isn't coming on properly. 1 second. Oh, still fuzzy. All right.
Let me.
There's a bit of a delay. Yeah, that's a little bit better, way better. Okay, cool. Yeah. um, yeah. So it was only if the audiologist had the tools to remove the wax they would remove it. I mean,
It
that's
was.
really bizarre.
I think the main crux of it is that people do have the kits to do that, but actually the ENT surgeon can definitely remove it. We do that, but why would you go to see an ENT surgeon
Mm,
for removing wax when actually you could have been done in the community, the most
mm,
specialised individual in the pathway and an
mm,
expensive individual? When actually, why could you not deliver that point of care in the community, so that then when they did need to go to ENT, they were appropriately going to ENT or appropriately going to audiology. So it streamlines, and you would start the pathway right at the beginning of the journey, so then you could push them to the appropriate specialist.
mm. And we spoke before, and you showed me your handy piece of kit. I mean, you also mentioned that you didn't have to be a specialist ENT surgeon or a specialist or a special audiologist in order to be able to use your technology. Could you tell the audience where your technology is being used?
Yes. So one of the main things that, in order, as I just mentioned, you can have specialists using the kit, but in order for it to be better for patients and more accessible, it was developing a kit that had the non-specialist in mind.
Mm,
So making it easier to use. We really worked on the ergonomics of it as well. And currently, what we do is we have a training program which is accredited by ENT UK and British Society of Audiology, which allows you to deliver the service. So already we have the kit is being used in Boots Hearing Care. They use it as they go to assessment tool. They've
mm,
multiple thousands of patients with the kit, and it's been predominantly run by what they call as their hearing care assistant, so a non-audiologist basically.
that's incredible. I mean, I think a lot of healthcare startups have really kind of benefited. I mean, as crude as it sounds, from the pandemic. I mean, how has the pandemic kind of affected your operations, good or bad? I mean, and what adjustments did you have to make?
So I think you're right. I mean, I think when the pandemic started, and with everybody,
Mm,
it's affected everybody, even myself. So I offered to go back and help in the front line, but also I was also thinking about how it works for Tympa. And at this first thing, you're thinking, well, okay, we're having a lot of traction now. What is actually going to happen?
mm,
But actually, the way that our system works, and the fact that you can develop this ear health record at the end, which allows for a specialist to review the image or video in anywhere, any location, it's almost accelerated the cause for and the need for technology like ours,
mm,
because one of the things that we have seen is that we're also doing telemedicine. We're calling it teleotology, and teleaudiology, but
mm,
it allows you to have your maybe other clinician, whether that be your hearing care assistant, to do an assessment of the patient in a community environment, and then allow a specialist to review that. And we've just finished a large pilot with University College London,
mm,
where we were kindly donated the room space by Boots Hearing Care for the University College London audiologists to go into their stores to see ear patients who were on a waiting list that wouldn't have been seen because they weren't coming to the hospital.
mm,
But the audiologist went into the Boots Hearing Care store, did an assessment, and those images were able to be reviewed remotely
mm,
by the ENT specialists in University College London, and the results have been pretty compelling and
mm,
show that it's a really useful service. So I think in terms of the pandemic, we found that it's almost accelerated the cause for something like Tympa, and we've had much more interest. We have had a lot of NHS trusts reach out to us, private providers, pharmacies. We've been doing a trial within a nursing home as well, because for them to access care is really challenging. So I think
mm,
each startup has had its own difficulties, and I'm not saying we haven't, but I think we have managed to actually um, come through the end of it with the realization that our technology is hopefully going to be the future for this sector.
That's incredible. And could you kind of talk about your journey to the prototype, and yeah, kind of talk about the journey to your prototype. I mean, did you have to attain any investment? Did you get any grants? From my understanding, you used a third party provider. I mean, could you talk about that journey, because it's quite compelling.
It's always difficult at the beginning of a journey of a startup. You've got
Mm,
an idea, great idea, and how do you progress that idea? And I think for me, I could see the benefit of the idea, having been and working, sorry, in the front line, and I
mm,
can still see that now. And so what I ended up doing was I entered for a few prizes and awards. So I won a couple of £1,000 just to get to a proof of concept. And I was at that moment in time also doing my PhD, so I had a bit more time to kind of get some clarity of thought. But once I got the proof of concept of a kit that I felt could do all the things, so a complete comprehensive assessment, I really felt was on something. And it was a interesting, because I was doing my PhD related to hearing health, and I was being seen as an expert. I mean, obviously, I do know about it, but I was
mm,
being called to give talks at the House of Commons and Number 10 about hearing screening, and I went to one very small event, which was an AGM for a charity. But
mm,
in there was the managing directors of some of the biggest commercial organisations
mm,
providing hearing services, and it was them that said, if you develop this further, it is something that we would look to provide.
mm,
And it was a very interesting story. I had applied for a grant as well, which was we were shortlisted to get it. But in actual fact, what ended up happening was we had a conversation with the hospital, and what we wanted to do was, rather than them perhaps kind of look to take ownership of the whole project, I said, well, look, we need to be fair with this. So I ended up not taking the grant, and I spoke to a friend who it was very much. I mean, you can imagine, like Dragon's Den. He said, I think there's a family office who'd be interested in
mm,
supporting you. They invest in technology which has a good social cause. And I went in and did a pitch, and they offered the first amount of investment, which was a significant amount, which then enabled me to look at, well, how can we make this fair? So as a company, we are an NHS spin out. The NHS have a very small percentage of the company, but it allowed us then to progress and move forward. And I think it has given an example, certainly to clinicians, of how you can innovate within the system, because it's historically very difficult to.
mm,
And I became part of the NHS England Clinical Entrepreneur Programme as well,
mm,
which is a program designed to help clinicians work on the innovation and help almost disseminate it into the system with advice, lectures, and great mentors. And I think that gave me a bit of insight. And it was that first amount of money that I got, I was like, okay, well, now it's real. And it came from really a soft bit of prize money to
mm,
get the proof of concept. And I think when I had something physical, rather than me just say, I've got this idea, I
mm.
think it enable people to really understand the product and concept and an issue we were trying to deal with, because it's quite a large issue, large problem.
Mm. Do you think your experience as an ENT surgeon really gave you the insights and the nuances that were required to build a product like you've built right now? Just because, I mean, essentially you're augmenting the whole of the hearing assessment pathway through one tool. I mean, that's huge. I mean, the nuances that you need to understand about the product have to be really, really specific. So, do you think your experience and your background enabled you to create a product like this? I mean, how did it help you?
I think it certainly did. I think I even speak to our technology team now, and other members who are joining the team, and I guess we all have excellent ideas. But
Mm,
what we have found underpins is that, even in other companies, you have a great idea, but actually, is it going to be useful for the end user and your end target? And I think, because I've been in it, and I'm using the other equipment day in, day out, it made me think, well, how can we make it better?
Mm,
And I think it really, the little subtleties in terms of how when you take the picture and it gets and video and it gets pinged up into our back end, how would I as a clinician want to review those images and look at other examples of where it's worked well, where it hasn't, and then particularly with the just user interface of the kit. As a doctor, you just want to pick up the kit, turn it on, add the patient details, and then get going. And even just the way in which you hold it enabled me to work really closely with the engineering team, but always have that end user in mind, because
mm,
sometimes, especially founders, we can go off in a tangent and think we've got an excellent idea, but if it doesn't, work in the field, then
mm,
it's never going to take off. And I think I've always kept to that belief of, if I was in the clinic, what would I want? And I think that has really helped significantly for us to develop a piece of kit that we have.
mm. I mean, you guys were nominated for the UX Design Award, which is huge.
Yeah.
I mean, are they? Could you highlight core fundamentals or principles that have contributed towards the product you built? Obviously, you being an ENT surgeon, but are there principles that you guys still adhere to right now?
Yeah, so I mean, it's very privileged to be nominated for that. They call it the Champions League of Design Awards, and if you look at the previous winners, I think it's Samsung,
Mm,
Carl Zeiss, Mercedes Benz. It's we're in esteemed company, but the principles that we have, I think, as we go to, and we've got further development that we want to do with the kit, really looking at how we can help that journey be a lot easier. And I think you're right. The fundamentals that we do when we speak to the engineering team and the tech team is really boil it down to, one, the patient. What are they going to experience? And that was one of the key factors in that design award, but also the user, and marrying the two together, because there's so much we can still do with the kit, but it may not be useful
mm,
to the end user. So I still, all the time when we're looking at the next stage of development, take myself back to the clinic room and say, okay, well, is that actually going to be useful for me? It might
mm,
sound cool to have that feature, but is it actually going to be to be useful? And I think that's the principles that we've adhered to. I think with the UX design, our app is simplistic, but it's very complicated in the back end. But at that front end, it flows really nicely. And I think that probably was one of the criteria. So yeah, we're very humbled to be in the mix, certainly to have the chance of winning it, I guess.
mm. From my understanding, I mean, you guys, especially at the beginning, you guys outsourced the development of the technology. Now, I know I know how incredibly hard it is to kind of manage an outsourced provider. Developing something so nuanced and so revolutionary as you've built, like what were some of the challenges in developing a device like this, especially when you use an outsourcer? And yeah, could you kind of highlight some of the things that really worked for you?
Well, I think first of all, it was finding the providers who almost were aware that there would be a lot of back and forth, because it was a new product we were bringing. So the same,
Mm,
it was finding the right provider as well. So we worked with an excellent team in Cambridge, Team Consulting, and we had an outsourced tech side based in Dublin. And it was really challenging, because up till literally this time last year, I was working full time as a doctor. And we had this product already out there in Boots Hearing Care, and it was a
mm,
lot of taking annual leave to go down to Cambridge to have meetings with the tech team, and working that your day job, and then in the evening having another job, and
mm,
alongside that managing that with children. It was really challenging. But I think I had the right partners with me that were able to evolve, and would make a very clear plan as to what we wanted to have achieved by a certain period of time, and
mm,
then it would be responding to that. And I think in all these things in outsourcing, it's the key is probably good communication.
mm,
Fortunately now, we're slowly moving away from that, have much more people within the team that can take that on.
Mhm.
It certainly was what we needed at that time, and it enabled also us to be really agile and,
Mm.
and really reactive as well.
Yeah, because for a long time it was just you, right?
Yeah, yeah. Yeah. When I mean it was, up till last year in terms of working within the company, it was just myself, and we were already being used in Boots hearing care. But I think that's part of the journey, isn't it? I mean, for me, I have an excellent team now, but at least now I can say that when there are issues, at some point in time, I would have had to have done that myself, or
Yeah.
so it's almost laid a good foundation. I say that to everyone that's joining. I said, well, we want to know about all the problems now, because as we grow and scale, then when that person who comes in and says, oh, I've had this problem, more than likely we would have faced it before.
Yeah, I can imagine. I mean, that's incredible. In terms of, there was one thing that I kind of wanted to talk about, and it was just ear health in general. Um, I mean, it's clearly evident that the ear health of the world is kind of declining just because we're using headphones for absolutely everything. Audiobooks
Yeah.
now, listening to music 24/7. Those new Apple Pods, podcasts. I mean, nothing exists unless we have an earphone in. Um, could you kind of highlight some of the dangers of kind of wearing headphones all the time? I mean, I'm pretty certain that our ears weren't made to have headphones in our ears for the best part of 8 hours.
You're absolutely right, Chet. I mean, it's actually going to become a bigger issue. So there's currently 500 million people in the world with disabling hearing loss now. By 2030, in the UK, there was a study which showed that hearing loss is going to overtake diabetes and cataracts in the top 10 disease burdens. So it's going to become a big issue.
Mm,
And one of the things with it is that it's been associated to a number of conditions. So it's linked to social isolation. You're 3 times more likely to have a fall. And this is the big one. It's the biggest modifiable risk factor for prevention of dementia. But the
really?
yeah, there's a big study, lots of studies out there that have so addressing your hearing can slow down that progression. And you're right, our ears weren't built to have these headphones, AirPods, or inner ear headphones blasting music into it, or now we're all working from home, we've all got headphones on as well. And one of the things which we don't know is that what is actually going to cause, what long-term effects is that going to have on our hearing. And we haven't had that data set certainly to show that. But it's like with your eyes, if someone said to you, oh, go and have your eye test every year, which you do. But if someone said about your hearing, said, let me take a picture of your eardrum, let me test your hearing annually. And if I can detect that there's going to be a change earlier and you can do something about it sooner, I'm pretty sure most of us would want to do it. But what I found with hearing, and I think it's not just us, but it's the whole sector, is that when you have a problem with your hearing, you're
Mm,
less likely to do something about it than with your eyes, because actually your hearing affects everyone else. It doesn't really affect you, because if someone can't hear you, you'll be like, oh, I'll just speak louder. Whereas with your eyes, it very much, you wouldn't be able to to carry out your daily activities. So it's a really challenging mindset to change, to say, well, actually, we should be doing annual hearing health checkups. And if it's made easy, simple to access, then why wouldn't you go and say, let me have a quick look in my ear? And with all the inner ear issues as well. So wax is one thing, but it's made to migrate. It's good for your ear. It lines the ear canal, but it migrates out. But if you're
mm,
constantly putting in things inside your ear, then it
mm,
goes against that migration, and it can get impacted. It can cause you to have an element of hearing loss, when actually it's not hearing loss, it's just wax. And
mm,
I think it's something that's going to become a bigger problem. And I think what we want to do at Tympa is not only make people more aware that you can just go and have a simple ear health check or hearing health check, but also with the information that we're gathering, we'll be adding in some of that machine learning and predictalytics to say, okay, Chet, your hearing is normal now today, and we test you each year, but actually we could have said to you at year 3
mm,
your hearing. We could have done something about it, but look, at year 5, you've now got a hearing issue, and I think that's would be the thing that we'd want to do, because that's why they take the pictures of
mm,
your retina when you go to the optician, to see
mm,
if there's any changes that they can detect.
What are the I mean, what are the preventative steps to kind of protect your ear health in general? You know, with health and exercise, they say, hey, don't eat fat foods, don't do this, but and it's generally true. Are there any general truths that you can kind of apply with your hearing health? Yeah.
Well, first of all, don't put anything bigger than your elbow in your ear, because that's going to damage your canal and your eardrum.
Mm,
And the other, in terms of general, I would say, not listening to prolonged loud music for more than 45 minutes to an hour. I mean, on the tube, you're hitting that, and then I think you would want to then give your ears a break. I think where you can, if you're working from home, not have the headphones on, and if you're not on a call, then
mm,
why would you not be able to just have your without your headphones?
mm,
And I think if you're going to have a prolonged period of loud music at a concert as well,
mm,
then you'd go to there, but then afterwards you would probably experience some ringing. And I think going to uh, events where you're constantly going day in day out, it's difficult when life, it's festivals. But if
mm,
you felt that prolonged ringing or change in your sense of hearing, then that would be a reason to certainly go and get checked, and have a look to see if anything could change your hearing over that period of time.
and maybe the answer might be the same, but if somebody does have like a ringing noise in their ear, I mean, is what's happening to the ear canal or the eardrum? I mean, for that to
So,
happen.
well, there's a multitude of things which could, what we call it is tinnitus, ringing in
Yeah.
your ear. And there's a multitude of causes for tinnitus. And it could be, you, like, sometimes we all get it. You listen to some loud music, and suddenly your ear starts ringing. But if it's prolonged, then there are multiple things, without getting too technical in the call today. But I
Mm,
think one of the things to be aware of, if it's in one ear only, then that's when you would probably want to get checked out. And if it's continuous, then go and get a hearing assessment as
mm,
well. And I think if it starts with tinnitus, it's more, could be, as I said, there's multitude in your related to your inner ear.
mm,
But what I would have suggested, if it becomes prolonged, then that's something that you would want to go and get checked out. It's tinnitus is notoriously a very difficult symptom to manage,
mm,
and they have tinnitus therapists which can support. The British Tinnitus Association has some great resources,
mm.
but it's such a vast topic that it's really challenging to find out the exact cause of what might be causing your tinnitus. But if it's prolonged and ongoing, then it would warrant you certainly going to get checked out.
I see. Well, I mean, I guess I'm just being selfish and just asking for myself. So, final question. Throughout this journey, I mean, what have been your most humbling lessons? Um, you've gone through the gauntlet. You've gone through the process where you're an ENT surgeon. You're having kids. You're doing your PhD. You're running in the company. Um, I mean, what have been your most humbling moments where you've had to kind of take a step back and kind of almost not check yourself, but yeah, kind of take hold of things and see things from a different perspective?
It's difficult because I'm sure so many startup founders have their ups,
Mm,
downs, and I think when for me, I think when it was probably quite early in the journey, when we had a very early part of our version 1 device, and then when I saw the kit, and this new kit as well, being used on a patient, I was physically in the room, and then seeing the feedback they gave, I thought, okay, well, wow, I've actually developed something here that has been useful to somebody. And then
mm,
when I then got the numbers of how many patients it had been used on, which is multiple thousands now, in boots, I'm thinking, well, wow, this has made a big impact on patients' lives, kind of in our own vicinity. But one of the bigger ambitions, certainly for me, is not just to get it right locally, but think about it globally. And the kit has been taken out and been used in Cambodia, and they found it incredibly useful to have a tool, which they normally would have had no access to that. There's a limited number of specialists. And I think seeing a kit that you have had a ideology and developed, and seeing it going to be used halfway across the world, with us also being able to help them with opinions, I think it made me realize that that's where we want to get to support those communities. But in order for us to do that, we need to get it right kind of in the developed world, to then obviously make it a commercially viable product, to then go out there and be able to support those communities. And I think that when those two things happened, I think it made me realize, okay, it does have some significant benefit here. And then it made me think, well, how do I get from where I am now to where I want to be? And I think as a key driver, and and then it's managing everything else that in life as well.
Yeah, I can imagine. I really appreciate you jumping on this morning. Is there anything you want to kind of shout out in terms of partnerships you want, hires? Are you fundraising?
Yeah, well, we are hiring for from the tech side of the business. We are growing our sales side, and I think it's always when you're given the opportunity to shout out to my team who are busy working away at Tympa Health, as well as everyone else who has helped on the journey as well. And thanks for giving us the opportunity to have a chat this morning, Chet.
Awesome. Thank you so much for being on this morning. Take care.
Take care. Cheers.